This presentation is sponsored by the Griffith Allied Health Clinic's physiotherapy practice located on level 4 of the G40 building of the Gold Coast campus. This online presentation will briefly explore the common condition known as tendinopathy and whether or not this could be the source of your pain. First of all, it's important to recognize that tendinopathy isn't damage to the muscle itself, rather where the muscle attaches into the bone. Tendinopathy is very common in both the sporting population and also throughout the general public. Some examples of tendinopathy that we see very often are tennis elbow, golfer's elbow, Achilles tendinopathy in runners, and patellar tendinopathy in jumping athletes. What you'll feel, depending on the stage of your injury, will be stiffness in the mornings or night, pain when you start to use that sore limb, and sometimes a crunching, grating, or generally unhappy feeling around that bone or muscle. And we'll go through why this occurs soon. A very common example of this is when it hurts to do the things you do every day, like picking up a kettle or trimming hedges or doing some gardening, and it's something that started off as a bit of a niggle and has gradually been getting worse. The healthy tendon acts similar to an elastic band or a bungee cable, which stretches when the muscle pulls on it and then recoils to transmit that force to the bone that it's attached to. The larger tendon unit is made up of hundreds of smaller units arranged mostly in parallel, similar to a bungee cable. These individual fibers are made primarily of collagen, which is the same substance that gives our skin the ability to stretch and then return back to its normal length. If the tendon, following a phase of increased stress, does not get a chance to adapt properly, then it undergoes processes that result in a change of the tendon itself. What occurs is that the tendon grows stiffer to deal with more force, and different types of tissues begin to infiltrate the tendon. These include nerves, blood supply tissues, different types of cells, and water, which are all less elastic and more brittle. As a result, the tendon becomes larger, but is less elastic and resultantly less efficient. It's important to remember that this is not an inflammatory process and is actually the normal response to a tendon experiencing more load and more stress than usual. So why have you developed a tendinopathy? Like any other structure in the body, tendons react naturally to increased force, either due to a change in lifestyle or if you've upped your training load. And this is similar to the way muscles adapt and grow, in that small amounts of damage stimulate growth. However, in a tendon, this process is a lot more tenuous. The initial response a tendon has is called stress shielding, and usually comes just before adaptations that result in a stronger, better tendon. However, when we don't give the tendon enough time to recover, it continues to undergo these changes and it enters into what we call a reactive state, where even more changes continue to occur. And if nothing is done to resolve the overuse that the tendon is experiencing, this continues on and can actually result in permanent negative changes. Tendinopathy can be incredibly painful if left unchecked and can result in debilitating loss of function. A physiotherapist can assess your aches and concerns and give advice on how to manage the tendon and the lifestyle around it. This will involve a conversation about use of the muscles and strategies to ensure that the tendon will return to full health. Once you've improved, the focus will be on strengthening the tendon at the appropriate speed to ensure that the same damage does not occur again, and to give you the right tools to cope with any future occurrences. The team at the Griffith Allied Health Clinic are experts in assessing, diagnosing, and treating musculoskeletal conditions. If you believe you're experiencing the symptoms of a tendinopathy or are uncertain as to the cause of your pain, do not hesitate to make an appointment as soon as possible and to call in and see our friendly team.